20 years ago, when we started KHPT, we were a small team of social scientists and public health experts that came together to solve a looming health crisis in the state. We started working on HIV in 2003, engaging with some of the most vulnerable and marginalized communities in the state of Karnataka. Over time, we realized that whether it was in HIV or TB or maternal health, the communities were facing similar barriers again and again. Information was not reaching them in a way that they could fully understand or fully trust. Many people did not know when to seek help, or what their test results meant, or how important it was for them to complete treatment.
At one point, we asked ourselves a simple question: what if people can ask about TB in their own dialects, in their own words, without having fear or judgment? That simple question led us to build Sangaati, which is an AI-powered mobile application especially for TB information. This Sangaati we have built in 10 different dialects of Kannada. This app we have designed especially for people who can't read and write, and they can use this by having with 3 simple steps: tap, ask and listen. From the very beginning, we built this app with people, not just for them. To develop this application, we sat with persons with TB, caregivers, frontline workers and our own fielded staff and collected more than 4,000 real questions people ask about TB. Once we collected all these questions, we created the answers and got validated from Karnataka State TB program, so the information is accurate and trustworthy. The app understands local accents because speech recognition is trained on native speakers. People can use it anonymously and ask most sensitive and personal questions without worrying about stigma.
This app is really helpful for the TB patients who are very in the remote areas also, because regularly TB patients, they can't come for their treatment to the PHCs to take the tablets. In this, they can inquire when they have to visit the doctor, when they have to come for the treatment, when they have to come for the follow-up, and when there is IP schedule, when there is CP schedule, they can check it out in the app. So like this, the app will help them to improve their treatment schedule. Even our health providers, they will go to the patient, their home, they will provide information about this Sangaati app and ask the patient to download this app, and they'll notify how to use this app and all.
Health workers repeatedly tell us that Sangaati complements their fieldwork. People with TB now have a source of information they can trust, which strengthens the ongoing relationship between the health system and community.
ನನಗೆ TB ಸ್ಟಾರ್ಟಿಂಗ್ ಬಂದಾಗ ತುಂಬ ಭಯ ಆಯಿತು, ತುಂಬ ಆರೋಗ್ಯಕ್ಕೆ ತೊಂದರೆ ಆಗುತ್ತೇನೋ ಅಂತ ತುಂಬ ಭಯ ಆಯಿತು. ಆದರೆ ನನಗೆ ಸಂಗಾತಿ ಆ್ಯಪ್ ಬಗ್ಗೆ ಗೊತ್ತಾಯಿತು, ಅದರಿಂದ ತುಂಬ ಹೆಲ್ಪ್ ಆಯಿತು ನನಗೆ. ಇವಾಗ ಅದರಲ್ಲಿ ನನಗೆ ಏನು ಇನ್ಫಾರ್ಮೇಷನ್ ಬೇಕೋ ಅದೆಲ್ಲ ಸಿಗುತ್ತೆ. ಇವಾಗ ನಾನು TBಯಿಂದ ಆರೋಗ್ಯವಾಗಿದ್ದೀನಿ, ಮುಕ್ತವಾಗಿದ್ದೀನಿ.
ಅನೇಕ ಬಳಕೆದಾರರು ಈ ಸಂಗಾತಿ ಆ್ಯಪ್ ಮುಖಾಂತರ ಅವರ ತಮ್ಮ ಅನಾರೋಗ್ಯವನ್ನು ಕುರಿತು ಅದರಲ್ಲಿ ಮಾತಾಡಿ ಅವರ ಕಷ್ಟಗಳನ್ನೆಲ್ಲ ಹೇಳ್ಕೊಂಡ್ರೆ, ಅಂದರೆ ಆರೋಗ್ಯದ ಪ್ರಕಾರ ಹೇಳ್ಕೊಂಡ್ರೆ ಅವರಿಗೆ ಒಳ್ಳೆಯ ಉತ್ತಮವಾದ ಫಲಿತಾಂಶ ಸಿಗುತ್ತದೆ. ಅದರಿಂದ ತುಂಬಾ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ನಮಗೂ ಕೂಡ ಹೆಲ್ತ್ ವರ್ಕರ್ಗೂ ಕೂಡ ಹೆಲ್ಪ್ ಆಗುತ್ತೆ. ಅದರಿಂದ ಸಂಗಾತಿ ಆ್ಯಪು TB ಬಗ್ಗೆ ಸಂಕ್ಷಿಪ್ತವಾಗಿ ತಿಳಿಸುತ್ತದೆ. ಈಗ ಮನೆಗೆ ಹೋಗಿ ನಾವು ಹೇಳ್ತಿದ್ದ ರೀತಿಗಿಂತ ಇವಾಗ ತಾನೇ ಅವರೇ ಆ್ಯಪನ್ನು ಒಂದು ಪ್ಲೇಸ್ಟೋರಲ್ಲಿ ಡೌನ್ಲೋಡ್ ಮಾಡಿಕೊಂಡು.
We are also carrying out a broader evaluation to measure the impact more rigorously. How Sangaati influences awareness, health-seeking behavior and treatment adherence. This evidence will help us and the government plan for a thoughtful scale-up. One of the strongest validations for Sangaati has come from government partners. All content is vetted by the National TB Elimination Program in Karnataka, and our implementation is closely linked with Karnataka Health Department through government systems. We recently demonstrated Sangaati to Honorable Health Minister of Punjab in Chandigarh. We shared our work and how we have built an application and our plans of extending it to other languages and dialects, including Punjabi. His response was very encouraging and it reinforced that this model can travel many parts of India.
Looking ahead, our vision is to empower communities and support frontline health workers, especially the most marginalized, who are the ones who often face the highest barriers to care and to services. Over the next 5 years, we hope to scale such innovations thoughtfully, generate strong evidence, and engage with the health systems across India. The dream is simple, an India where no one is left behind because of the language they speak, where they live, what they do, or whether they can read or write.